Сайн байцгаана уу хүнд үзэгчдээ. Өнөөдөр манай Defacto нэвтрүүлгийн зочноор Америкийн нэгдсэн улсын Станфордын Их Сургуулийн анагаахын сургуулийн профессор хирург ноён Самуэл Со оролцож байна.
Самуэл Со Станфордын Их Сургуулийн профессор, Азийн Элэгний төвийн үүсгэн байгуулагч, гүйцэтгэх захирал. Самуэл Соны Америкийн нэгдсэн улсын Миннесотагийн их сургууль, Хонконгийн их сургуулийг тусдас төгсжээ. Тэрээр Америкийн нэгдсэн улсын эм хүнсний газар зөвлөх, Америкийн элэг шилжүүлэн суулгах комиссийн гишүүн, хүүхдийн элэг шилжүүлэн суулгах судалгааны төвийн үүсгэн байгуулагч, дарга, Дэлхийн эрүүл мэндийн байгууллагын номхон далайн бүсийн зөвлөхөөр тус ажилладаг. Самуэл Соны хорт хавдар судлал, элэг шилжүүлэн суулгах мэс засал, элэгний хорт хавдрын анхан шатны эмчилгээ, архаг гепатит Ц'гийн хавдрын эмчилгээгээр мэргэжсэн бөгөөд Америкийн нэгдсэн улсын шилдэг эмч нарын нэгээр шалгарсан.
Good afternoon.
Good afternoon.
World Hepatitis Day 2018 is celebrated these days, and we had a substantial, very important international meeting yesterday, and you were the guest speaker. Please tell us about what brought you to Mongolia.
We came to really celebrate the commitment of the Mongolian government to really bring Mongolia a major step closer to eliminating chronic viral hepatitis, and by so doing is actually making an important step towards reducing liver cancer. As you know, Mongolia has the highest liver cancer rate in the world. And
that's higher means exactly how you calculate that per capita?
It's per 100,000 population. So Mongolia has the highest rate. And this is really due to a preventable disease.
That would be, I mean, how many people sick with this hepatitis, or what is the calculation?
Well,
what
according to the World Health Organization estimates, in Mongolia, as many as 12% of the population may have chronic hepatitis C, and another 8 to 10% may have chronic hepatitis B. And the danger of these infections are they are usually silent. Most of those people who have these infections don't have any symptoms until they become sick from liver cancer or advanced liver cirrhosis. So this is why it's so important that if you are an adult in Mongolia, you should do a one-time blood test. Just a one time. You don't have to do it more than once to check whether you have chronic hepatitis B and whether you are also infected with chronic hepatitis B or whether you have immunity. Because hepatitis B, we have a very effective vaccine. So anybody who has not been sort of infected, all they have to do is get a 3-shot vaccine, 3 shots over 6 months. It can protect them for life. So that's why very often in our media campaign, we have this sign, 3 shots, okay for life.
Okay for life. Very sad to learn that 12% of population has the C. And have they this 12% already got vaccinated in Mongolia?
Well, C, there's no vaccine. So you have to make a difference between B and C. So
B has a vaccine.
Yeah, B has a vaccine, and B.
C no.
B, I think Mongolia has done a very good job with vaccinating infants and newborns. So I think for the young people in Mongolia, especially children, most of them should have been vaccinated and are protected, because the vaccine was only sort of made available about 35 years ago, and in Asia, most of the countries did not actually start vaccinating newborns until 1992. Okay, so a lot of the older adults, maybe over 21, may still be vulnerable, because if they weren't vaccinated when they were newborn, right? So I think both diseases are more of a problem in adult population. I think the prevalence in children will be very low. The reason for one is most of the children, young people, have been vaccinated. For C, a major way people got hepatitis C is in the old days through unsafe injections. Okay, it could be from, in the old days when you don't have disposable needles and syringes, right? People could have been exposed to that. People in the past who, had surgery, blood transfusion, because before the 1990s, people didn't know there was hepatitis C, so there was no test to, check for blood.
So the whole world didn't know about it?
Yeah, whole world didn't know. So,
oh my goodness, okay.
So that's why if anybody have an operation before the 1990s, they could have been exposed to hepatitis C, because, in those days, even the blood bank don't have a test to check for it. So we in the old days, we used to call it non-A, non-B. Okay. Because we didn't know there was a C. Yeah.
Wow. So we had a time in the 50s having this hepatitis, but people didn't know. Then people were just, in the 60s, 70s, people were dying because the cancer, liver cancer, all the time. People are dying. And we didn't know that it was caused, this hepatitis C, long time before the death, right? It's happening. How long, by the way, it's happening? Once a person gets that disease, it's a virus, right? Virus. Once they see hepatitis C virus, how long it usually takes time to get that person having a cancer and dying?
So usually with chronic hepatitis C, it usually does take over 20 years, 20, 30 to 40 years later. Then when those who got infected develop damage to the liver, which cause scarring of the liver, we call cirrhosis, then they run the risk of developing liver cancer. But for B, B is a very old virus. Recent study this year suggests hepatitis B is between 8,500 to 21,000 years old. And in the last 10 years, it has been discovered in mummies, mummified children in Korea, as well as in Italy. So this is a very old virus. For B, the risk is actually a lot of people in Asia got infected at a very young age. Some of them from the mother who carried the virus to the newborn at birth, if the newborn did not get vaccinated. And the vaccine was not available in the old days, right? So for those newborn who got infected at birth, then they can run the risk of developing cancer as young as in their 20s and 30s, because usually 20, 30 years later, right? So if you look at many countries in Asia, liver cancer could affect a lot of people in the middle age, between 35 to even 54. So a study from 2010 showed that actually liver cancer in China was the second most common cause of death for middle-aged people living in China because of hepatitis B.
So because they did not discover it before.
Before there was no vaccine.
So now what you are saying is hepatitis B is completely, you can cure.
No. Hepatitis C, a few years ago, the major discovery, which now means that hepatitis C, for the first time, you can cure it with taking just a pill a day for 2 to 3 months. That's it. So C is a no-brainer now. If you test positive and needs to be on treatment, all you have to do is take a pill for 2 to 3 months, and you're cured. And
C
once you're
you can cure.
Yeah. B, they are very effective pills too. It's a pill a day, but you have to take it potentially for life because it's not a cure. It's like HIV. You can't cure it, but you can suppress the virus. So
how about the vaccines?
The vaccine is good if you've
vaccines
never been
are for
infected. B, yeah.
And so Mongolians who has a hepatitis B, they can have either vaccines or a pill.
If you already have hepatitis B, right, then the vaccine does not help to treat it. Vaccine is only good to prevent.
Prevent, okay. To prevent, if once you have it, then you have a pills. But still, you can use this pill, and this will not bring that hepatitis B viruses to the cancer. They will not.
It will greatly reduce the risk. But not totally. It will reduce the risk.
You are a doctor, and many days you spend making surgery on liver, and you have been doing liver transplants, right? How many years you are doing that, and how many people?
Over 30 years.
Over 30 years transplanting liver. And this transplant of liver were not possible until last year, I think, in Mongolia. They tried a couple times here, but it is not that much bigger. It's only a few cases, just this country just learning to do so. From when the world started to transplant liver?
Oh, the earliest successful transplants were done in the United States. There was a very famous surgeon, Dr. Tom Starzl, who really pioneered the field. And by the time I entered, where I actually did like 70 transplants per year or so just by myself. The success rate back in even the 1990s, in our center was already 90% successful. So the liver transplant now are very successful, except if it is transplant for liver cancer, there's still a risk the cancer after transplant can come back.
Oh, I see.
So the best way is actually prevent people from developing liver cancer, because liver cancer to this day is one of the deadliest cancers, because most of the time, by the time it's discovered, it's already more advanced. And when it's more advanced, there's no effective chemotherapy. Okay, so the best way if people develop liver cancer is if you can catch it very early, then you can successfully remove it, right?
I see.
But even after removal, liver cancer has a higher risk of it coming back. So when I treat my patients with liver cancer, I have to follow them for life. So every year I will have to do an expensive scan, MRI, CT scan, maybe twice a year initially, or 3 times a year, and then after a few years you still have to do it at least once a year.
Wow.
So you can see all the expenses, right? Whereas if you prevent it, it's going to save Mongolia tons of money if you can.
Mongolia, in every household, every person. Just go and check whether you have B or not.
Or
if
C,
you don't
B
have
or
it,
C.
get vaccines, right?
Yeah, B is C. Because of this incredible medicine, you can cure you in 2-3 months. You know, that's why every adult in Mongolia should get a one-time blood test for
Just
for
once.
C.
And
It's not like a cholesterol test. You don't have to do it more than once. If you don't have it, you know.
Every Mongolian should go right now if they have not done yet, right?
Yeah, get a one-time test for B, one-time test for C.
How many interesting you have made a liver transplant in your life?
How many liver transplants
Yes.
I've done? Probably several hundreds. But you know, transplant is very expensive.
Yes.
Right? And also it's limited by the organs. So even in U.S. every year there are many people waiting for a liver transplant, and some of them die before they have access to a transplant.
The donor liver.
Yeah.
Here I remember certain private cases where either close parents or children, sister, brothers were donating life, donating. Does it work in the U.S.?
But ideally, you would like to use an organ from someone who recently, became brain dead from a car accident or whatever.
Okay.
Right. Because then you don't subject another person having to have an operation.
Yes.
To try and save a life. In our center we usually only use living donor for transplanting children, because if you transplant a child, the donor, to a child, you only on the adult you only remove a very small piece of liver.
I see.
Okay, but if you transplant another adult, the donor may have to give up almost 50-60% of his own liver. So the risk of surgery is higher, right? So we don't, in our center we don't do much adult living donor transplant.
So
we do it
child.
Just if it's donating a child, because it's
why the child would have in the U.S. that need?
Children usually are transplanted not because of cancer. They're usually transplanted for congenital liver disease. They are born with a liver which doesn't function well.
It's transferred from mother.
It's not, it's not an infection from a mother. It's just a congenital condition. Right?
Wow.
So in the old days, our center, we did a lot of liver transplant for children, especially under 1 year of age.
Should be very tiny work. It's such a small
It's a lot of work
baby.
because the blood vessels are tiny. We have to wear magnifying loops to connect a little tiny blood vessel together. So, but for these children, because it's not caused by infection, right? It's just a congenital problem.
Tell us about this Asia Liver Center at Stanford University, which you have created. Why Asia, and what are you doing there?
So, what I found when I moved to this, west coast of America, because I started my career in the middle of America, Midwest. Very few Asians, right?
Which state?
Which I was in Minnesota and then Missouri in St. Louis.
Which years?
Which
years it would be?
That was back in the 80s, 1980s.
Okay.
So when in that part of the country, people who have liver disease usually are caused by hepatitis C, which in the U.S. is mainly due to using drugs, injection of drug use, and then also alcohol, from alcoholic cirrhosis. So when I moved to the West Coast to San Francisco, we always joke that because we moved to the West Coast in search of better Chinese food.
Are you from Hong Kong originally?
Yeah.
You were born there.
We know, Asia. People from Asia loves to eat,
Yeah.
right? So when we moved to the West Coast, then I found then I see Asian patients dying from liver disease, and they were dying from a totally different disease. A lot of them were dying from liver cancer, and dying from liver disease caused by hepatitis B, which is very uncommon in non-Asian. Okay. So, and then I found, wow, what's going on? Why are these Asians not getting diagnosed that they have hepatitis B, which caused the cancer? So I found out, we did studies and surveys. A lot of the Asian community are not aware of this problem. Okay, they are not aware of how serious chronic hepatitis B could become, right? So they don't actually go and get regular checkup and screen for liver cancer. And then also we found that a lot of the doctors also are not aware this is a big problem. So in the U.S., if you are a white American or Latino American, the chance of that person have chronic hepatitis B is 1 in 1,000.
Wow.
If you are Asian, it's about 1 in 10, 1 in 12. Right? And the doctors were not aware, so they don't screen. They don't do the test to do a one-time screening. Right? So, and a lot of the doctors also didn't feel comfortable or didn't feel proficient in caring for these people because they don't understand how to take care of people with chronic hepatitis B. And furthermore, we found the government wasn't doing anything about it except just vaccinating newborns, right? So there wasn't a comprehensive approach with prevention, diagnosis, and treatment. So that, to me, is just, I see Asians dying, needlessly from a preventable and treatable disease. And if nobody was doing anything about it, then I need to do something about it. So that's why I founded the Asian Liver Center to address
Which year?
The gaps. 1996.
96. Yeah. And since then, what do you have been achieving?
So over the years, we actually helped to address a lot of the gaps. Okay, in the U.S., we address the gaps in national policies. So now, after 20 years, so if you are foreign-born from pretty much most parts of the world except Western Europe or North America, the blood test for screening for hepatitis B is now covered by government health plans and private health plans with no out-of-pocket pay. So, and then the Hep C test is also covered for anyone born between 1945-65 because the US CDC sort of studies show that population, the baby boomers, which we are baby boomers, right, that are at the highest risk for having Hep C. Okay. So that is also covered by health plan. So, and we actually also developed, I belong to a committee of the National Academies of Sciences, Engineering, and Medicine. The last 2 years, we came out with a national strategy for, elimination of hepatitis B and C in the U.S. So over the years, we have, managed to change national policies and put it on the national agenda. But still, there are a lot of work left. We need to make sure doctors will tick off that box.
Yes.
And what we are trying to do is, in America, we are starting to use a lot of electronic medical records. So with the electronic medical records, when the first time the doctor see a patient, the electronic medical record should have a box that already tick off that test should be done.
Okay.
So that's how we
see.
want to build
Wow.
into the system. So it's a no-brainer. Because doctors have many things they have to worry about. But if you make it like as effortless as possible, then they'll be more likely they would.
So it means in the US, data of health data of any patient can be seen by any doctor wherever they go. They have such a united one database.
They're trying to put that all together. So,
Yeah.
But the key is the first time the patient see a new doctor, right?
Yeah.
So
correct.
then the doctor should, don't even have
Check.
to think about it, because a lot of these now are built in.
Yes.
So if you
Okay.
see the patient, if I'm a doctor, I see a patient at the first time, the computer screen will already have what tests I should be doing.
I see.
Right.
Well, so one of the efforts you are, through your center, created this jade
Yeah.
ribbon. Tell us about that.
So, as you know, branding is very important for anything.
Yes.
For a business product, for Coca-Cola, whatever, Nike. So, I think equally important in health, because if you don't have a nice brand, people don't think about it,
Yes.
right? People don't want to go and talk about hepatitis, liver cancer.
Yes.
Sounds very boring. I mean,
Yes.
it's depressing. So if you, build the awareness around a brand.
Yes.
So we use the brand. We borrow this from the red ribbon from HIV, which has become worldwide, widely recognized. So we use the jade color, jade ribbon, right? And jade, as you know, in a lot of cultures, it represents health
Yes.
and longevity, right? It's good.
Yes.
So we use the jade color and jade ribbon to try and bring people around the world to eliminate hepatitis B and also reduce liver cancer. And also be compassionate for those people living with viral hepatitis, because sometimes people have misconception as to how these hepatitis are transmitted, and they may be keep that distance from these people,
Which is happening
for
in
no
some
reason.
culture.
Yeah,
There is, which is not actually happening.
right.
Well, we in Mongolia are very happy that you visited Mongolia.
Thank you.
Your knowledge, your experiences are important for overcoming these issues in Mongolia. As you said, unfortunately, we have the highest per capita this disease, and hopefully our conversation will help many to think twice about their health situations.
We also want to bring up that we collaborated with the Ministry of Health and developed a training course for health in Mongolian for targeting all primary care healthcare providers, nurses, as well as doctors.
What a wonderful job.
And so because what I found traveling around the world is most countries don't have a formal curriculum to train healthcare workers about knowledge, prevention, diagnosis, control of viral hepatitis. So as a result, 2-3 years ago, we started working on this project. So now healthcare workers across Mongolia could just log on to the website and take this online training course whenever they want.
And in Mongolian as well, right?
Yeah, in Mongolia.
Fantastic.
We just actually, yesterday, we launched it in the morning.
Yes.
Officially launched the course. And if healthcare workers, after they completed the course and passed the final exam, the test, then they can print out a certificate which acknowledge that the healthcare workers has successfully completed the course.
What a
issued by
great job.
Stanford University and the Ministry of Health.
Wow, what a great job. What a great initiative you are doing with our officials, with all our medical officials. Thank you very much.
Thank you.
Really, I enjoyed this
Thank
conversation.
you. Thank you.
Thank you. За хүн төлөгчтэй өнөөдөр манай Defacto нэвтрүүлгийн зочноор Станфордын Их Сургуулийн ангаахын сургуулийнх нь тийм Элэгний төв гэж байдаг. Энэний дарга алдартай мэс засалж ноён Со оролцлоо. Их баярлалаа.